Hi everybody, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you live from our Hazleton location today. That's on the Beltway in Hazleton. The address is 281 Airport Road. Our phone number here at the office, 570-453-2020. If there's ever any questions or comments, please feel free to contact our staff or the doctors here at the office. Our website, if you want to catch us on the web, www.drkislan.com. For those watching in the Stroudsburg area, our Stroudsburg office is Stroudsburg Eye Specialists. That's on 9th Street in Stroudsburg, 570-421-3342 in Stroudsburg. And you can catch us on Facebook also. Make sure to look for all the posts that Dr. Deom puts on Facebook, since he's way better at that than I am. Folks, we're so excited today to have the Budga family on our show, and there's certain times that patients come in that just not only hopefully we can change their life, but sometimes they change our lives. And I'm very happy today to be joined by Keith Budga, that's Dad, and Logan over there is 5 years old. He's joining us, and little Lucas, today's actually his birthday. He's 1 year old, and obviously Dr. Deom's here with us also, and we're going to talk a little bit about Lucas's story on how he got his first pair of glasses. And so I'm going to kind of turn over to Dr. Deom here, since Dr. Deom is the one who actually saw Lucas. So take us through kind of what's happened here.
So probably a couple months ago, I had the honor of seeing Lucas, and Mom brought him in, and came in with a complaint of having an eye turn, which is not uncommon for parents to note early on in childhood. And the unique thing about Lucas is, of course, his age. He's 8 months old, and so he was 8 months old at the time. And so it was one of those things where sometimes people think, well, maybe it's too early for me to go see an eye doctor. When I go to an eye doctor, you have to be able to read the chart. How can my son or daughter accurately have an eye exam, and what is going on here? And so interestingly, the American Optometric Association has a program called the Infant C program, and it's something that Hazleton Eye Specialists has been a proud provider of for quite some time, and I also am a provider of the Infant C program, which is a public health program aimed at doing eye exams, a comprehensive eye exam, for children between the ages of 6 months and 1 year of age. And so that's how we had him come in.
And why is that important? A lot of people think, well, the development's not done yet. Why is it important for us to see kids between that 6 and 12 month time period?
You know, the eyes are developing just at a rapid pace between that early stage, and the child is starting to see its world, and the interaction between the world and the child is what actually makes that child develop on so many different levels, on a verbal level, on a tactile level. It's all tied to being able to see the world properly. And so in Lucas's case, we were noting an eye turn, and you know, maybe I'll pass it on over to Dad to kind of shed some light on, you know, what your experiences was leading up to here, and also what happened at the office and then afterwards.
Well, we noticed the eye turn early on when he would try to focus in on close objects, far away objects. And we decided to do something, because earlier on you catch it, we can correct it before he has a problem down the road. Yes, our pediatrician also noticed that he was eye turning.
Okay.
On focusing.
Okay. And how did you end up coming into the office? Did you know about the infancy program?
I think she also had mentioned, our pediatrician had mentioned that there was a program out there available.
Okay.
For children under the age of 1, and they would be able to get a free eye exam to evaluate it.
And how was Lucas before he came in? You were noticing the eye turn. Did he seem to be developing correctly? Was crawling and everything was on?
He was developing correctly and everything, and it just it didn't seem to hinder him too much. as far as crawling, as far as touching, as far as grabbing stuff. But
So he seemed doing pretty good, except for the eye turn,
pretty decent,
right?
yep.
Okay. So then, Dr. Deom, when you saw him in the office, then
So
what?
we saw him in the office. First of all, he was just a joy to see. He's actually a really good little guy, and really
Better than most of our senior patients, right?
Really pretty easy to examine, which is, parents are always like, they're ready to like strap him down because they're sure that they're going to crawl all over the place. But he was actually really relaxed, and it took a little while. But the interesting thing, and something else I want to say, is that we can really get a lot of information from a child or someone who's not able to verbally communicate. We have many different ways of examining somebody's eye status and determining what a prescription would be for them and so forth without getting a really good response. And with children, we can see how they respond by crying or not. And so with Lucas, I was able to tell right away that consistent with what mom and dad were saying, that he had a very high prescription that when uncorrected would lead to a eye turn. And what we call that is accommodative esotropia. And so we noticed that and said, well, let's get these glasses for him. And so, thankfully we are a provider of Miraflex frames, which I'm just going to show real quick to the audience here. Miraflex frames, which Lucas has on, are made out of a very durable plastic, one-piece construction, which allows them to very easily put it on the face and be very comfortable and durable for the patient. So we're one of the only providers that have this particular frame line here in the area for children, of this age. So we were able to get the frames for him. It was really a magical moment. Maybe you could maybe you could tell everybody what happened when we got the glasses.
he cried up until about 30 seconds before the glasses went on, and he instantly stopped when the glasses went on, and he just looked around the room like he saw everything for the first time. It was very impressive. It was a really great feeling. I know we all smiled and we said that's what we wanted to see.
Yeah. It was awesome. I know, through my training, you hear about things like that, and I had seen other children at his age and with similar issues, and never had that type of reaction. I knew that in other cases that it was good as well, but that was just one of those miracle moments where it was like, oh man, this is it.
It was really neat.
And so since then, what have you noticed with Lucas? Have you noticed
He's watching
anything?
TV,
Okay.
and he never did before. Now he will sit there and watch cartoons with his brother, and of course we like cartoons, right? So
Don't we all, right? Don't we all?
so we were watching cartoons, and we noticed that he also was getting involved in it. He could throw the ball and go catch it. He would go find it.
And they were things maybe he
He wasn't
doing.
really doing before.
Okay.
He wasn't.
So you've really seen his kind of gross motor skills kind of developing now a little bit more and just more attentive. And
in the last two or 3 months since he has them now, it's really been
That's great.
really neat to watch him.
So in Lucas's case, Dr. Deom, really he had the eye turn, which now with the glasses on, because it's not an eye real muscle problem that requires surgery, with the glasses on, the eyes are straight. Why is that important as far as eye-brain development?
That's a great question.
What if that didn't happen? Let's say we just thought Lucas was going to outgrow it, and mom and dad, he wasn't brought in, and now he's 4, 5, 6 years old.
Right, and this goes back to why infancy is so important. What happens is with the eyes and the brain, there's connections between each eye and the brain. And the information that is coming to the brain from each eye needs to be robust and needs to be the correct way. And what I mean by that is the eyes need to be directed at one object in space at the same time. And if they're not, what happens is the brain says, oh, I see 2 images now. I see double. And you know that if you see double, even for a short period of time, it's very disturbing. And so what the brain does is it says, I'm not going to focus on that second image anymore. I'm going to pick one image, and then that other side of the brain, as a result of that, does not develop properly. And so that can be something that leads to vision loss and loss of dexterity and depth of field and depth of perception. So we're we're much better than where we were. This is something we're going to follow and monitor the prescription over time, and maybe work with his eyes a little bit with some exercises, and you know, just continue to work on, and hopefully we don't ever have to talk about surgery, you know. And so, but really avoiding and prevention through early exams is really the thing we like to drill home here.
Because a lot of this, if it's not corrected now, patients can end up with what we kind of throw out there, term lazy eye. A lot of people think lazy eye is an eye that just is turned, but it can be an eye that actually doesn't develop correctly. And once that's gone, we can't get that back when the child's 10, 11, 12 years old.
Right. Yeah, so, you know, you've heard lazy eye. That's a term that, you know, I don't really like to use. But it is what everybody says, and so it makes it easier to communicate. But the real term that, you know, we use in the office is amblyopia, and that is a term that is given to an eye that hasn't developed properly. And really, the eye is healthy. It's just that it's looking at something that it shouldn't be, and the brain doesn't develop properly. And so, you know, what these glasses do is they allow his eyes to relax and focus directly straight ahead at one object. And it's just amazing that, you know, as I'm talking here and looking at him, he's all over everything.
Yes,
you know,
he is watching every word.
He's all over it. Yeah, it's great. And so, you know, that's just it warms my heart. And you know, definitely the message that we'd like to give to everyone is that, you know, if you have a child between the ages of 1 year and birth, bring them in. We have this program. It's called Infant C, and it's a free program where we will do a comprehensive exam, not only checking their vision, but their binocular status. And what that means is how the eyes work together as a team, making sure that they have that depth of perception that's appropriate for their age, and also look at the health of their eyes. We look inside their eye, we check their eye pressure, a very comprehensive exam.
I mean, it's really amazing. We need to take a break here, folks, but I really want to thank the Budga family for coming in. I want to thank Dad Keith and Logan. You were great. And Lucas, of course, for coming in on Lucas. Happy birthday, buddy. We'll see you on the next segment, folks. Again, you're watching Eyecare Today. Welcome back to Eyecare Today, folks. Again, I'm your host, Dr. Thomas Kislan, and on this segment, I'm very excited to have the Solt family with us, Mom Christina and Rachel, to tell their story. And of course, Dr. Deom, who actually saw Rachel as a patient. And I'm going to kind of turn it over to Dr. Deom and Mom and Rachel here and let them tell their story about really how eye care and development are all related.
Thanks, Dr. Kislan. So again, thank you guys for coming on today, and it's been a pleasure getting to know both of you and your family, and look forward to getting to know you more. And it's been a lot of fun so far. And so what we have to talk about today is kind of something a lot of our viewers probably have no real knowledge of. So I'm going to try and give a little bit of background to explain a little bit about what it is that we've done so far and what you've done to help us get to that point. So the vision is not just 20/20, and what I mean by that is our vision is not only how clearly we see letters and images in space. We have two eyes, and each one of those eyes needs to be directly pointed at one image in space, and so that area of eye health is called binocular vision. And we can test the level at which people's eyes are aligned properly. And so many individuals have eye alignment problems, and working the eyes together as a team is intricately related to reading. Obviously, because your eyes need to be focused on the letters, right, as we're looking at them and reading them. And then also, our eyes have to move efficiently as we look to read. And so there's many different types of eye movements. And so we can scan things in space. We can look from one spot to another very quickly. And those we can look in at something, which makes our eyes focus this way, and we can focus our eyes out this way. So those are 4 or 5 different types of distinct eye movements that are related to different parts in the brain. And so when a child comes into our office, we not only test their visual acuity and their eye health, but we also test their binocular vision, which is how their eyes move together as a team in all of those distinct ways that I just mentioned.
And if that binocular vision is off, what happens? Like in Rachel's case, what can be going on?
That's a great question. And so what we look to do is ask further questions. We want to know how they're doing in school, how they're functioning with other children, what their attention status is, because if they're not able to see something clearly, then what they see is double. Okay, and that double may not be all the time. It may be after they're stressed, after they're working for long periods of time, after they're reading for long periods of time. And so that was one of the first things that we noticed in Rachel's case. And so I'd like to turn it over to Mom now, because I'm talking too much, about what your experiences have been and what led you to come in the first place.
Okay. Thank you, Dr. Deom.
My pleasure.
Initially, we noticed that Rachel had a real severe problem with focusing and attention. When she was 5, we also noticed that a lot of her letters were backwards. So we monitored her letters and numbers. We worked with her. I read as much as I could about dyslexia, and they said not even to bother worrying about it until 7 years old. So we waited. Her reading didn't improve, her spelling didn't improve, her writing was atrocious for a child her age. And we began to wonder, is there something more that we need to do? So eventually we had her tested. And we did receive a diagnosis of ADHD, and she had a reading comprehension disability and a writing disability. And we were advised to put her on medication and to give her occupational therapy. But when I asked why it was happening, nobody could really tell me what was happening. She'd been wearing glasses for a couple of years. It was tough because she wouldn't wear them all the time, and I was constantly telling her to put the glasses on. So, you know, there's a little tingle that says, are they even doing any good?
Sure.
So we wondered about the glasses, we wondered about medication. We're not big fans of having kids on medication all the time. So I started to look online and to see if there was anything else that we could do. And at one point in my working career, I was working with illiterate adults. And one of the techniques that I was told to do was to put a red or blue filter down on the paper and see if that would help. And in Rachel's case, she immediately looked up at me and said, "Mom, they stopped." And that's when I asked her, what stopped? And that's when she told me, my letters and numbers stopped moving. That's when I started wondering, okay, now what's really going on? And I found Dr. Deom. And Dr. Deom said, yes, that is something that we can work on.
So let me jump in here. So Dr. Deom, let's elaborate on that a little bit. What was going on in Rachel's case?
Right. So she came in, she told me the whole story there, and I said, wow, that's great that you've already started some of the treatment that we do in some cases. And so as I was saying before, the way the eyes work together as a team, what we found was that there was some deficiencies in the way that her eyes moved together as a team, and also there was a deficiency in her eyes being able to converge properly. And convergence of the eyes is integrally related to being able to read efficiently. So what this filter does is it allows the contrast of the letters to be 10 times what it is when there is no filter there, and allows the eyes to focus much more accurately there. But we also noticed these other eye muscle issues, and so we then went down a road, a path of trying to get everything back together so that in the future we're not reliant on the glasses with the filter. It's a great thing to do and very helpful, and it puts us in the right path. But we then went down a road of a treatment schedule for her to solve this convergence insufficiency issue. And another thing that we did at the same time was a battery of tests that look at her visual perceptual skills, which is a whole nother level of vision. Again, that's not well, that isn't, many people don't know about it, and it is a real thing, and it's something that should be known more about, and it's something we do evaluate. And basically what that does is it looks at when we see something, what does the brain do with that image? What meaning is given to it? And maybe you could shed a little more light on the treatment that we've done since then and where we are now.
Okay.
And before you do that, Mom, just so the viewers know at home, while we're talking here on the screen, they're going to be showing some kind of before and after pictures of kind of Rachel's work, kind of before and then after some of these treatments. So go ahead, Mom, kind of elaborate then.
Well, I do want to note that we chose not to go with the medication or the occupational therapy. So we have literally been doing eye therapy. And what we have noticed with Rachel is that she is actually even starting to enjoy reading. It used to be such a trial to get her to read. She writes better, incredibly. I mean, it has been probably a 90% improvement within a year on her writing abilities. She was unable to focus to even do a set of 3 instructions last year, and she followed a set of 6 instructions with no problems this year.
7 instructions.
Seven. Excellent.
And how have the grades been?
Her grades have gone from D's to A's and B's. Her spelling is still a work in progress, but that's something that you build on, and it has improved greatly. It's just been such an incredible experience to see my daughter blossom this year.
That's got to be just so amazing. You know, in the couple minutes we have left, Rachel, maybe you can tell us just how has this all been since you've gotten the new glasses and you're using the filters and the therapy? Do you feel better about your schoolwork and reading?
Yeah, I feel more confident with my schoolwork. I feel much better. I like doing reading and other things. Like before I hated math so much and I did bad in math, but now that I have the glasses, I'm doing much better at reading and math. My letters I can write smaller than I used to.
That's great. And I know, Dr. Deom, we're going to talk in some other shows specifically about the therapy that Rachel's doing, but Rachel, just tell me, do you enjoy doing the therapy? Is it hard?
Some are hard, some are good, but after I get stars and things, I get really excited.
And I bet you get lots more stars now than you did before, right?
Yeah.
So, Mom, just kind of wrapping things up here, maybe just let the viewers know from your experience how important do you think it is if you don't think something's right, you know, getting the eyes checked?
I think it's incredibly important to get the eyes checked. I think it's also incredibly important that you find an eye care provider that will look at the different testing that you can do on your eyes, but not everybody does. So if you think that there's something wrong with your children's vision, bring them into a provider who's going to do a full scope of tests and check and make sure that their eyes are working together.
That's great advice. Rachel, thanks for coming on the show. You did great. Mom, I think what we may want to do is invite you guys back, because I know you were talking about doing actually some articles. You've had some things published about this. I'd like to elaborate on that. So I'd like to invite you guys back. We'll do a whole show on this, because I think this is such an area that people need to know a lot more about. And Dr. Deom, thank you very much. Folks, that was the fastest show I think we've ever done. We need to wrap it up, so I appreciate everybody watching. You're watching Eyecare today, and we'll see you next time.